Thank you so much for having us here today. I want to really appreciate you all for joining. And so my name is Eli Flores, and soon you will hear from my colleague Mariana Yamamoto as well. We are really excited to share with you today two important things. One is talk about the census operations and provide you an update directly from the Census Bureau, and we are in constant communication with the Bureau, and then also give you some insight into reaching Latinos for the census. And I think right now more than ever is we got to consider how to shift our work to make sure that we reach as many people as possible. Keep it in mind that social distancing is happening. Keep it in mind that there's major restrictions around how many people can gather in one place, which really has forced both the state and local community organizations to shift the way that they are trying to motivate and activate people to respond to the 2020 census. So as Madeline shared, we are from NALEO Educational Fund. NALEO Educational Fund is a national nonprofit organization. We facilitate the full Latino participation in the American political process from citizenship to public service. And sort of to give you an idea of how that is done, we do this from three ways. First is policy research and advocacy, and so we a lot of our work having to do with policy has to do with pathways to citizenship, voter protection, and the 2020 census, and ensuring that the census is fully funded to do the operation it has to do. NALEO has been working on the census for about 30 years now. This is the third census that we've been working on. And for our CEO, this is his fourth census. So we come to you with a wealth of knowledge. Second part is constituency services. We have a membership base of elected and appointed officials from across the country. So that is also another way that we engage Latino electeds and making sure that they are providing the best policies, the best practices to make sure that Latinos receive the needed services they need. And then lastly, the 2020 census work that we are engaging in now, and we'll be telling you more about that today. So just as a point of reference or reference of context, we understand based on the fiscal year of 2017 that the census data really drives the allocation of federal funds at $1.5 trillion a year. And so if you take a look at the programs or the top 12 programs that we have listed here, and again, these aren't the only programs, but these are the top 12. And if you notice, majority of them have to do with health, have to do with nutrition or education or housing. So these are crucial programs that even today, right, are being regularly talked about on TV. So think about why and how the census really is important to make sure that we do everything we can to get all of our state to respond because of these crucial programs. And also as a point of context, California is really at the top of receiving a pretty big amount on an annual basis of federal funds for these type of programs. So an undercount in California would really hurt the funding for crucial programs that our folks need. Another thing that we definitely want to use as a point of context is that in 2010, there was about 2.2 million very young children missed, and there was a double count of about 1.2, so the net undercount of 1 million children. 400,000 of these children were Latino children. And unfortunately, California led the way in the undercount of children at 210,000. So it's important to keep that also in perspective as when we're talking to community members, families, and parents about the census, about the reminders to make sure that they count their children on the 2020 census. So quickly, and I'm sure you are familiar with most of the census operation, but again, the goal for the Census Bureau for 2020, right, is to count everyone only once and in the right place. And again, the 2020 census will count people wherever they live on census day. So April 1st is really the North Star date that you have to keep in mind. whether you are filling your census form today or you are filling it out a month from now, April 1st is that North Star date that you have to keep in mind. So to put that into context, if a child is born on April 1st or before April 1st, then they are to be counted in the 2020 census. If they are born after April 1st, then they are not to be counted on the 2020 census. So this is one of those like pieces of context of why the April 1st date is so crucial to keep in mind. And again, right, so how will the 2020 census invite everyone to respond? I think most of you will probably know this information, but 95% of households in the United States will receive their census invitation by mail. I would say most households have already received this invitation in the mail, and most households, if they have not yet responded, have probably already received a reminder card in the mail as well. So keep that in mind. Also, almost 5% of households will receive their census invitation when a census taker drops it off. And I'll go deeper into this operation soon. And then less than 1% of households will be counted in person by the census taker instead of being invited to respond on their own. So one of those processes that I was talking about just now is called update leave. And this is update leave really refers to a Census Bureau staff updating an address of a household and then leaving material so that that household can self-respond. They can do this by mail, telephone, or online. So you see here on the screen, the areas where this operation is happening is U.S.-Mexico border regions, Puerto Rico, and a couple of other regions in the United States. So an update on this operation has actually been extended to May 1st because of COVID-19. Most of this operation would have been already underway and would have been close to being finalized, but because of COVID-19, this operation has now been extended. Slightly different is the update enumerate operation. And again, this was the 1% of the population that would be counted in this way. Again, this approach is used in remote areas which are particularly hard to reach, including certain parts of Alaska, Maine, and certain Native American areas. So again, this operation has now also been extended through May 14th, when normally this operation would have been done sooner, but because of COVID-19, this operation will also indeed be extended. Now the self-respond phase, this is the phase where we are currently in right now. This phase started as of March 12th when homes began receiving their census questionnaires, and the date where it was expected to end was April 30th. So we have now been informed that due to COVID-19, the self-respond phase will actually be extended. So as of 3/20/2020, responses will be accepted all the way through August 14th. And just as a reminder to the 95% of the population that will be invited to respond, to self-respond, there are 3 ways. So first is online, and everyone has access to this. And if you receive your mailer, you will receive a code to make this process a little easier for you. There's a phone version. So there's actually 12 phone numbers with 12 different languages where folks can actually respond. And then there is a mail and paper form. The mail and paper form, there is a certain 20% of the population of the 95% that will receive the paper form at the front end, but majority of the population will not. They will receive the invitation, and it is not until the 4th mailing that they will indeed receive a paper form if they have not yet responded to the census. And again, this is an example of those dates where you will be receiving, or where people will be receiving, these letters and these reminders. So as you see, we are between the March 26th and April 3rd reminder postcard being mailed, but within 2 more mailing periods, if folks have still not responded, they will receive a paper questionnaire in the mail. So that is when they can actually receive it, if that is their desire to still respond via paper form. And again, as I mentioned before, there is phone numbers that are directly associated with particular languages. So these are phone numbers where folks can be assisted in this particular language. Now, you will notice that this is not all-inclusive of all of the languages that are represented in the country, but this is what currently exists on the Census Bureau side. So use this as a resource if you have stakeholders or populations that would require assistance in one of these languages. There is, though, a lot of language assistance and a lot of materials and resources for 59 non-English languages that are also available. I think post-webinar we can share the link to this, but this is accessible online, and this will be materials that will help guide folks through the questionnaire. And there's a language glossary, there's language identification cards, so really good resource that the Bureau has available to assist folks in many more languages. So with that, I will cover these last two parts, and then I will give it off to my colleague. So the non-response follow-up phase, for those who are probably aware with this phase, this is a phase when census takers begin to go to the communities and begin to do the door-knocking operation to all of the homes that have not responded to the 2020 census, which is why we are urging communities to respond early so that a census taker does not need to come out to the doors. So as you see on this screen, that operation includes the usage of mobile devices, leaving notices in order to nudge a response, making up to 6 attempts. So this is an operation that was supposed to begin as of May 13th, and it was supposed to go through the end of July. This has now been extended, so this phase will now begin May 28th and has been extended all the way through August 14th. And again, this operation, as it stands right now, will still be happening starting in May 28th, but we are monitoring closely all of the operation of the Census Bureau as we understand that things can possibly get worse because of COVID-19 before they get better. So we'll continue to monitor this, and we will provide updates as they come to us. We will provide these out to all of our partners. So with that, I want to thank you, and I'll still be here for questions and answers towards the end. But I do want to now pass this on to Mariana Yamamoto, who is our California Census Program Coordinator, and she will go ahead and go into the counting of special populations, in addition to our Latino messaging and research, and lastly, some strategies to shift outreach efforts to be more digital and more aware and conscious of the the current circumstances around COVID-19. So thank you so much for your time.
Great. Thank you, Ellie. And thank you, Madeline, for having us in this presentation. Again, my name is Mariana Yamamoto, and I am NALEO Educational Fund's California Census Program Coordinator, so happy to be here. So I'll start us off today with talking about some special populations and the processes that will take place in order to make sure everyone is counted in the 2020 census. So let's get started. So first, one of the special populations are individuals who are living in group quarters. So group quarters is a term that's used to refer to residences like nursing homes, college or university housing. It might be residential treatment centers, correctional facilities, or shelters that are housed under this group quarters enumeration. So the Census Bureau actually has a very specific way in which they will count the residents in group quarters, and that is through they work directly with the administrators of those facilities in order to arrange the enumeration of all of their residents. Now, I will note that because of COVID-19, the group quarters enumeration process has been delayed a little bit. So originally it was going to be starting in early April on April 2nd, but now it will be starting in mid-April on April 16th and be extended to June 19th. So The way in which this process works is that the Bureau would reach out to the staff and the administrators of the group quarters, and they'd work together to figure out the best way in which to enumerate their residents. So that might be through an in-person visit, transferring the data files from that facility to the Census Bureau to administratively count the individuals living there. It might be that they train a point of contact at that facility to be the enumerator, or they might drop off and pick up the paper questionnaires and have the residents fill out those questionnaires. Now again, due to COVID-19, the Census Bureau is adjusting a little bit this process and is encouraging group quarters facilities to see if there's a way that they could work with e-responses or drop off and pick up questionnaires in order to reduce and minimize person-to-person contact there. So there might be some adjustments being made in the case that you know of any folks or staff members who do work in group quarters. Individuals who are in prisons or correctional facilities will be counted using the group quarter system. That includes correctional residential facilities, federal detention centers, prisons, and local jails. So they will also be using this process for enumeration. Students, that we've received quite a few questions about students, especially given the closures of various universities and college campuses in response to COVID-19. So college students who are living on campus in a dorm or any sort of campus housing are counted through group quarters. And because of COVID-19, even if those students have been moved off of campus, they will still be counted on campus using group quarters. So the school administrators will be and should be working with the Census Bureau directly to ensure that those students are counted. Now, if college students are living off campus, maybe in a house or an apartment, they will be counted using the same process that Ellie had just been talking about, where they receive a letter invitation to their home and they should respond using the online, phone, or mail system. For boarding students who are below the college level, so if folks are under the age of 18 and they're living in a boarding school, they should be counted at the homes of their parent or guardian. They will not be counted in their school site, so that's a special exception for students. And for students who are living outside of the U.S. or maybe studying abroad for the year and won't be in the U.S. on April 1st, then they will not be counted in this 2020 census. Now, military personnel are also counted through a special system that the Census Bureau has. So that includes group quarters for personnel who are living in military installments or a ship of sorts. So that is the process that is used. And then for individuals who are stationed overseas, they will be counted using administrative records and a data transfer file that the Census Bureau works to arrange with the leadership. Now, we get a lot of questions about how individuals who are experiencing homelessness are counted. So the Census Bureau does devote 3 specific days to counting individuals who are homeless across the country. So these dates were adjusted in response to COVID-19. Originally, they were going to take place at the end of March and on April 1st. However, these dates, as you can see on the slide, have been adjusted to late April, starting April 29th, all the way to April 1st, in order to respond to COVID-19. So you can see here that the Census Bureau will go on one day to visit the shelters to count individuals who are in shelters on April 29th. On April 30th, they'll be visiting soup kitchens or mobile food vans, those service providers, and any individuals who are accessing those services on April 30th. And then they'll, on May 1st, be counting individuals who are living in non-sheltered outdoor locations and ensure that those folks are counted as well. Now, these dates might be affected further based on COVID-19 and might be adjusted. So this is something that these dates are something that we're keeping an eye on as the situation progresses. Now, we also have a process for individuals who are living in transitory locations. Transitory locations might include RV parks, campgrounds, hotels or motels, carnivals and circuses. So maybe they don't have a usual home elsewhere but are living in one of these locations. Similarly to the group quarter system, the Bureau does contact these locations in advance in order to arrange a good time to work with that residence to ensure that the residents there are counted in person. So that's where the Bureau goes and is enumerating each of the individuals there. This process has also been delayed due to COVID-19. It was also set to start in early April, but as you can see, it's been delayed to April 23rd and extended to May 18th in order to respond to COVID-19. Migrant and seasonal farm workers, you can see here that depending on the situation of the individual, they'll be counted in a specific way. So if we have farm workers who are living in dormitories or some form of fixed living quarters, they'll be counted using the group quarters system. For those who are living in regular housing units, would be counted through the mail, so they would receive that mail letter invitation to participate and would respond accordingly. And then for those who might be living in trailers or tents or RVs, they would be counted using the transitory location process that we had just gone over. Now, as Ellie mentioned, we really want to make sure that our young children are counted. And so during this time, we really want to emphasize the importance of making sure that everyone in the household is counted. So reminding family members or caregivers that they first coordinate, right, that their child is being counted, especially if a child lives with mom and dad and there's shared custody, or the parents with shared custody. So making sure that child is only counted in one household. As Ellie mentioned, the babies who are born on or before April 1st should be counted in the home where they live and sleep most of the time. However, babies born who are after April 1st will not be counted or should not be counted in the 2020 census. The mobile Questionnaire Assistance Center is actually a process that was developed by the Census Bureau. So this is a strategy that is going to be used in order to do rapid response to areas that the Bureau sees as having lower response rates. So these mobile questionnaire assistance centers would be deployed with Census Bureau staff with a key, like a tablet or some form of way for folks to respond in real time and offer assistance to any individuals who are responding. Now, due to COVID-19, the deployment of these MQACs, or Mobile Questionnaire Assistance Centers, has been delayed until mid-April, all the way to August 14th. And so this is something that we're also keeping an eye on as the Bureau continues to adjust their operations and their plans to do their part in response to COVID-19. But this will be something that is available for individuals to receive assistance in responding. Now, I'm going to touch a little bit about the messaging research that NEL Educational Fund has done for the Latino communities. This is research that has been done in 2018 as well as more recently in the fall of 2019 to see what types of messages resonate with Latino community members when we're talking about the census. So first, one of the big things that we saw in the 2019 survey was that a majority of our respondents shared that it was very important to respond to the census. So that was really good news, but we always need to continue to push the message about why the census is important to participate in. With that excitement for participating in the census, we also saw some concerns when it came to participating. So concerns around whether the census website was secure from hackers, how census information would be used. We continue to see questions and concerns around the citizenship question, and how, again, if and how this census information would be used for things like immigration enforcement, or if the Trump administration would use the personal information in any way. So one of the things that we saw in both our 2018 and 2019 research was a preference to complete the census by mail using the paper form. We did see some preference to using the online form among respondents under the age of 30. However, there did seem to be some confusion around, or a lack of clarity, in fact, around how the online process would work. So really a need to continue to educate and share with the community about what the online form is going to look like, or it does look like, and how folks can use that tool in order to respond on behalf of their household. Some of the messages that we tested that really resonated with our Latino communities was, first, in 2018, the message that the census was convenient, safe, and required received a positive response. In 2019, we actually saw, in addition to this message, that the community empowerment message was something that resonated. So sharing that the census is an opportunity to stand up for your community, stand up for each other, and be counted. That the census was about public funding and having a 10-year impact was also a message that resonated. In addition, on this slide, you can see that sharing these messages and also sharing facts about the census was something that was really important, that helped to bring confidence in participating in the census. So that included sharing about the law that protects the information, census information, and keeps that information confidential. Facts around how the citizenship question is not on the census, et cetera, et cetera. So these helping to augment these messages with facts was something that helped build confidence. Lastly, I'll go over these real quick. Some recommendations that we have here is making sure that we're continuing to educate the community about the options for completing the census, that it's not just the online option, but we also have the phone and the paper questionnaire, and making sure that we emphasize that every single person in the household counts. In addition, making sure that we are using communication strategies that are tailored to the community and our audience. So continuing to really be mindful and intentional with what we're communicating and how. And continuing to promote the participation, making sure that we're really empowering our community in order to respond, and reminding folks what will be asked on the questionnaire and what will not be asked, and making that distinction very, very clear. And one last interesting point that I'll share with you is that we also should be thinking about how to avoid politicizing the census. That what we saw from our research is largely that Latinos did not associate politics with the census. So making sure that we keep that distinction, and that the census is really about how we can continue to bring power to our community, bring resources to our community, and really be heard. So some things to consider as we're all making this digital shift and thinking about how we can adjust our plans in order to still get out the count. So these are some suggestions here, thinking about what types of online activities we can do in lieu of in-person activities, whether that's online meetings, Facebook Lives, Instagram Lives, Twitter, how we can use telephonic pressers in order to educate our media about the importance of the census and have them carry out that message. Also doing webinar trainings, things like this webcast are really great in order to be educating our leaders and equipping our leaders with the important information about the census to share out. There's a lot of great apps and things that we can be using. and really thinking about the high impact locations that we can have. So places like the health centers with which you work, or the grocery stores, the pharmacies, where we can be putting up posters or leaving handouts for people to take. One thing that I'll mention here is, really leveraging broadcast, print, and online targeting is really important. So again, leveraging our social media tools, and also thinking about in your local areas what TV, radio, and print media exists that you can also be engaging. NALEO Educational Fund has this great communications toolkit that was released earlier this week that has sample PSAs and some great top-line messages that you can be using as you engage these media sources. Some additional ideas, just thinking through what how you can engage your existing volunteers, whether that's a virtual phone bank or whatnot, letter writing, how we can engage our personal networks, and kind of creating maybe a phone chain or a phone tree in order to amplify the census message. Thinking about, being creative with our media and our digital tools, so creating video testimonials or a speaker series that can help elevate and engage our community about this work. And just a friendly reminder for all of us, I know I need this reminder at times, but just to also spark joy and embody care as we continue on this work. So NALEO Educational Fund has a ton of resources that you can pull from, and we welcome you to use these. No need to reinvent the wheel. So we do have a national campaign called Hágase Contar, or Make Yourself Count. And so through this campaign, we have, ready-made fact sheets, a train-the-trainer curriculum that you have access to, different stakeholder information, and digital tools that you're welcome to use. In addition to that, we have a sub-campaign in order to ensure the full count of our young Latino children, and that's called Hazme Contar, which means Make Me Count, from the perspective of a young child. So here we have a lot of tools for individuals who work with families or young children. So that includes the schools or early education providers and teachers and parents. So this is a great resource for you as well. This is our website where you can access all of the information and download any tools on there. And one really big resource that I want to emphasize for everyone here too is our National Bilingual Census Hotline. It's 877-EL-CENSO. And this hotline is available Monday through Friday, 8:30 a.m. to 8:30 p.m. Eastern Time. And our bilingual staff, who speak both English and Spanish, are trained and ready to answer any census questions. So if there's a particular question that you receive from a community member that you're not sure what the answer is to, you're always welcome to refer them to this hotline, and we can answer those questions or point them in the right direction. So please feel free to use this resource in your work. I will note that there are additional census hotlines that are available to you as well. So for individuals who may speak Arabic, there's a hotline operated by the Arab American Institute that's live and available. For individuals who speak Asian languages, Asian Americans Advancing Justice, AAJC, is also running a hotline. And then the Lawyers Committee for Civil Rights has a hotline as well that is available to answer questions. So there's a lot of tools that you can turn to, and we definitely encourage you to use them. Just some quick reminders, ways to get involved. We do have NALEO Educational Fund staff all across the state. So if you're based in a particular region and haven't connected with one of our staff members yet, please reach out and we'd be happy to facilitate that connection and get you introduced. In addition, again, there's a lot of toolkits that you can pull from, and we also have a text message chain or campaign that you can also opt into. So every time that we release a new resource, a new video, you can be getting that notification too. And And here is mine and Ellie's contact information for your reference as well. So please don't hesitate to contact us. And you can also find Naleo Educational Fund on the social media, on Twitter, Facebook, and Instagram. So feel free to give us a follow. So thank you.
Awesome. Thank you, Mariana. Hi, everyone. My name is Madeline Anderson, and thank you for joining me this afternoon. And thank you to Ellie and Mariana. I'm a census intern here at CPCA, and today I'll be covering community health centers amid COVID-19 and census operational changes. So as a brief overview, I will share who we are here at CPCA and what we do, and the community health centers at a glance that we represent. I'll also share with you a brief COVID update and COVID-19's impact on community health centers, as well as sharing the new census environment and resources for census outreach. So some of you may already know about CPCA's work. CPCA is the California Primary Care Association. We represent 1,370 non-for-profit community health centers, or CHCs. These CHCs provide quality healthcare services to a significant number of Californians who otherwise might not have access to healthcare. CPCA is also the health sector lead for Census 2020. In 2019, CHCs served 1 in 6 Californians, or 7.2 million patients. Of these 7.2 million patients, 35% were non-English speakers, 56% were Hispanic, 18% unknown, 9% API, 7% Black, and 7% white. Also, CHCs served 635,000 migratory workers. Before I discuss how COVID-19 has impacted CHCs, I'd like to share a brief COVID-19 update. As of March 25th, there have been 3,006 positive cases and 65 deaths in California. There have been 2,120 of these cases were acquired through person-to-person transmission travel, including cruise ship passengers, and some are also still under investigation. This number also includes 46 healthcare workers. And then there have been 826 community-acquired cases. So COVID-19 has significantly impacted CHCs. Many CHCs are currently experiencing a 50% drop in regular visits as patients self-quarantine and health centers shut down non-essential services such as non-emergency dental services in order to direct sources to COVID-19. Some health centers have been utilizing telemedicine or telehealth as a way to safely access patients while containing the spread of COVID-19 in healthcare settings. In addition, health centers are hurting financially. Unless the current situation changes, within 3 months, over a quarter of CHCs will have exhausted funds to pay operating expenses, and another 25% will have less than 1 month's cash worth on hand. CHCs are in immediate and urgent need of personal protective gear, or PPE. Specifically, CHCs are in need of both N95 masks and gowns, face shields, surgical masks, exam gloves, triage tents, and shoe covers. So what does this mean for the new census environment? Right now, CHCs must prioritize the health and safety of all patients. This means census work is being shifted online to prevent community transmission. Engaging patients in the census is more important now than ever, as the health sector's readiness to handle emergencies like COVID-19 depends on accurate census data. Health center staff can promote the census by sharing these messages with patients. Social programs directed by census data has helped keep people afloat in the wake of COVID-19. When people go uncounted in the census or data is inaccurate, community resources are stretched thin. Better data will lead to better emergency response. Responding to the census is the best way to ensure communities have funding they need to address public health emergencies. You can direct people to 2020census.gov and encourage them to complete their census online, by phone, or by mail. You can also share CPCA's My Health Counts website, where patients can learn more about how Census 20 data impacts their access to health services. Our website also has tons of amazing resources, including health toolkits, coloring sheets, social media graphics, fact sheets, and downloadable contents for health centers by health centers. We also encourage you to use hashtag MyHealthCounts or hashtag Census 2020 in social media campaigns to raise awareness. And lastly, I'd like to share that CPCA is currently working on releasing a health sector digital toolkit through a COVID-19 lens to help those working in the health space engage people in the census. And I'd like to thank our partners at NALO for inspiring us with their digital toolkit. In addition, this afternoon we released a Census 2020 amid COVID-19 talking point that health center staff can utilize in social media campaigns, press releases, or outreach material. So that is the end. At this point, I'd like to open it up to any questions. And any questions you have for either me, Mariana, or Ellie.
I have a question.
Of course.
I was wondering, since a lot of clinics are losing money and stuff because of COVID-19, has a new strategy come up, like to reach out for money to those like with big corporations, and or to reach out for financial assistance to keep on like providing services to the community? Do you know about that?
Yes, I do know that health centers are definitely reaching out for more funding. Yes, health centers are definitely reaching out for more funding. It's also, this is why it's crucial that health centers engage in census outreach, as this definitely will impact their funding in the future.
Oh, I see.
Yes.
All right, well, thank you.
Thank you. Are there any questions for Mariana or Ellie?
I actually had a quick question. I want to thank you, first of all, for organizing the meeting, and also thank the presenters as well. The information provided was really helpful. And in terms of the question around race, what is the best practice when folks, particularly from Latin America, don't know what to put down for race? They don't want to identify as white, and they're not affiliated with a tribe either. Should they just skip the question? What are other folks, how are other folks talking about this question?
Yeah, that's a great question. So I think first is, in 2010, number 8, which you're referring to, which is the Latin, Hispanic, and Spanish origin question, and number 9, which is a race question, were 2 of the hardest questions for Latinos to answer. I think first is sharing the importance of answering number 9, which that does provide you the opportunity to actually answer more than one if you identify as more than one Hispanic or Latino origin. And then when it comes to number 9, which is a race question, this is actually very difficult, right? Because most folks that, I would say most Latinos that answer question number 8 are going to think that they've already answered the question for what their race or their ethnicity is, right? And so unfortunately, this federal government continued with this question, and there is not a lot of options there. So there's already some studies by the Census Bureau that some other race, which is an option in number 9, will probably be the second, or if not the largest racial group after the 2020 census, because a lot of people are not going to feel comfortable answering for any questions. So for that question. So first, I would definitely probably stay away from telling people to skip that question, because any skip question does raise the likelihood of a census enumerator or the Census Bureau reaching out to that household to try to find the answer for that question. So that's first about skipping questions. We probably would recommend not to skip questions, right? Two is if they truly, don't find their race and how they identify on number 9. I mean, some other race is an option for them to, list down whatever racial category they do identify with. But it is important to share with them that if they choose some other race, the Census Bureau will reassign them a race. So it is almost like symbolic that they would select some other race and click and put in there whatever racial category they're going to want, because the federal government does not recognize some other race as a racial category. So they will be reassigned. So if a person really wants to have agency over that number 9 and not have, the Census Bureau just provide them a racial category, they can decide what their racial category is on number 9. And again, some other race is an option for them. So unfortunately, there is not a clear way of how to tell people to respond. And so then the other thing, as a service provider, we also want to discourage you from pushing people to respond a certain way, meaning pushing them to maybe identify as white or any other racial category if they don't truly identify with that racial category, because then you are indeed tainting the self-response of that household. So because this is a self-response operation, it needs to truly be self-response. So you can explain the question to them, but a best practice is still allow them to respond to that question. And even though they may have a lot of questions themselves about that question after you explain it, it is still something that we really want to urge that household to respond for themselves. So I know that's not the best answer I can give you, but it is, I think, the best advice that we are providing both to service providers, nonprofits, and to people that are themselves responding to the census.
Thank you. And I'm just curious, do you know what they would be reassigned to? What is like the default race?
Not necessarily. So the Census Bureau has their own sort of mechanisms of how they do that. I'm not entirely sure. I know it's based on other sort of data sets for those specific areas. And so, they have a whole method of how they do that, and I don't know exactly how they do it. I know that they have to use other data sets in order to figure out what racial categories they would reassign to the individuals that list some other race.
Okay, and my last question, I promise.
That's okay, you can ask more.
If somebody identifies as indigenous, then they should mark that regardless of whether they have documentation to prove it. Is that correct?
Correct. So it is a self-response process. So the Bureau is not going to be trying to figure out if your response is true or not. It is a self-response process. So if the person does identify as indigenous, then if they select that racial category, then that's what their self-response is. So yeah, there won't be any like fact-finding process for the Bureau.
Okay, thank you so much.
Yeah, no problem.
Hi, Maddie, can you hear me? This is Rebecca.
Yes, I can hear you.
Oh, great. Hi, everyone. Apologies for earlier. I had muted myself. I just wanted to take a moment to briefly respond to the question about what CPCA is doing around funding or seeking additional funding for clinics who are seeing a significant drop in patient, just the volume of patients, but also just removing essential health services. So anything that is not considered essential, clinics are essentially just moving off the table. I want to share for those who, some of you may be following some of the legislation that is happening at the federal level There's been quite a bit of activity that has taken place this week. I'll just be brief and share a summary with you. So the Senate voted on this massive emergency relief bill earlier this week. I think it was Wednesday. And just earlier today, the House of Representatives voted on that bill. It's called the Coronavirus Aid, Relief, and Economic Security Act, also known as the CARES Act. And that bill essentially set aside a massive $2 trillion for COVID-19 emergency relief efforts. And so, what does all this jargon mean? It essentially means that Congress, both the House and the Senate, finally agreed on a dollar amount that they would set aside for different industries. This, of course, extends beyond the health sector and beyond community health centers. This is funding for, corporations, essentially just industries across the board, including hospitals, to try to provide emergency funding. So this money is an attempt of the government showing us, the country, that we are looking to, provide money for what is considered emergency. And so of that funding that was of the $2 trillion, community health centers receive about $1.32 billion, which really is not much. And among that $2 trillion, health centers receive more funding for other programs. But what I think is important for you to know is that, this money is of course being set aside for what is considered essential and emergency. And I think for health centers, it's really sustaining a workforce challenge, because even health providers and physician assistants, nurse practitioners are operating under very critical and challenging circumstances. And in addition to that, as you may know, or can just maybe jump into an assumption, is that every health staff, whether you are working in a hospital or a health clinic, is in dire need of personal protective equipment, meaning that health center staff member is likely in need of, I'm drawing a blank on the things that you put over your mouth. That should seem very obvious. A mask, thank you. And, just gowns. I mean, these are things that just the health sector across the board is looking for. So I say that to try to paint a realistic and humanistic picture of what the impact is to health center staff, but not just to health center staff, also to patients and community members, because we know patients are not looking to go to the clinic because, one, you're with other individuals, and what does our executive order say? Stay home and try to protect yourself and your loved ones. And so the clinics are taking a huge impact. And so what I shared is taking place at the federal level. We do know that they're looking to roll out 2 additional federal bills. We don't know when the timing of those bills will come out. We do know that Speaker Pelosi is looking to take leadership in the next one. And then the last one, this is the one that was voted on today, the third one. So there will be 2 more. The 5th one, we do know that would be kind of like, let's try to get the economy back up and running. So this one today was like emergency funding. The 4th and 5th, and likely the last one will be, okay, this is post-COVID. At least this is the way that Congress is thinking about it now. Let's kind of jumpstart the economy again. So those are federal, efforts that are currently taking place now. And as you can imagine, all of that work and ping-ponging between the Senate and the House is just a moving target. At the state level, some of you may also know that the legislature is no longer, of course, working in person, at least they're remote. And so what we have been doing as a health center community is we've been in close contact with elected officials at the state level. We are in conversations with the governor's office. We're in conversations about the dire need of personal protective equipment. There are conversations with, just the administration, Department of Public Health, where we're coordinating different efforts to secure, PPE equipment in different regions for different health centers. So it's a multi-pronged strategy that we're looking to do, both in terms of ask for money, but also in terms of equipment and other needs that we know health centers are looking for on the immediate front. So it's not a straight answer. I apologize. I wish it could be a short and brief, concise response, but we're looking to do what we can to try to just meet the needs of what we know are some real challenges that are being faced on the ground.
Thank you for sharing that information and actually answer my question. And thank you also for mentioning about PPE that many of the medical staff are being like not being protected as they're supposed to be. And yeah, thank you. Thank you, Laurel.
Yeah, thank you for asking the question.
Thank you.
Are there any other additional questions? All right, awesome. So if there are no more questions, we'll go ahead and end the recording. Thank you for everyone for attending today. Thank you, Mariana and Ellie. I hope you have a great end of your day.
Thank you.
Awesome. Thank you all.
Thank you, everyone.
you.